The Minister did sign a new health order which will ask anybody who works or who leaves the Fairfield local government area for work is tested every 3 days to demonstrate they're negative. That also will apply to people working in the regions. We will ask people who are working or moving between Greater Metropolitan Sydney and into the regions to get a weekly COVID test, even if they don't have symptoms, just to make sure that we reduce the incidence of essential workers passing on the virus.
Getting a test every 3 days, they're going to have to isolate until no, that's not correct.
No, this is a protective measure. They won't have to isolate. It's a measure just to go and get the test.
Surveillance testing is a concept that I think the community understands. We've talked about it in the context of quarantine, where our workers undergo surveillance testing and they don't need to isolate. So our quarantine workers undergo daily salivary testing and when they're at work. And what we're doing is basically instituting surveillance testing.
Anybody with symptoms should not be doing anything apart from getting a test and staying at home. But through the abundance of caution, if you're an essential worker, leaving Fairfield local government area or leaving Sydney and going to the regions and have no symptoms, we still want you to get tested in case you have the virus and don't have symptoms. So this surveillance testing that Dr. Chant refers to is only for people who don't have symptoms, because if you have symptoms, you should go nowhere apart from a test and inside your home and isolate. So I just want to be very clear that this additional testing is what we call surveillance testing. It means for people who don't have symptoms, who may not even have any symptoms whatsoever, but it's an extra degree of caution to make sure that people unknowingly don't spread the virus, and that's the difference.